guys, my name is Dr. Danielle McGinnis. I am an integrative movement doctor, and so I help work with individuals and help them connect more deeply to themselves on a physiological and emotional level. And so the lecture that I'm going to give today is going to discuss how we navigate between your physiological nervous system responses and how that is a crucial aspect in developing and cultivating a true ability to communicate with yourself that leaves you as a thriving, robust human versus someone who is physiologically and emotionally exhausted and feeling victimized by the world. And so I believe that the different pieces of the puzzle can't be overlooked if you're truly seeking an evolution that's rooted in true, authentic reconnection to self. And so the first thing I did want to talk about was how the nervous system is the foundation for all things that we're going to discuss today. And so I want to talk about how emotions are just responses to stimuli, whether that be internal or external stimuli. And so often, as a result of the environments that we grew up in, or even prolonged exposure to specific environments or traumatic environments, our emotional responses tend to happen outside of our conscious awareness. And so, especially if we're out of touch or we're in this incongruent nature with our emotions. And so, our physiological primal desire to stay alive and functioning is more important to our body than we can even cognitively think about. And so I want to discuss what's called the Polyvagal Theory, which was founded by Stephen Porges. And so the Polyvagal Theory covers 3 different nervous system states that are going to help us when we dive into how we connect with ourselves and communicate with ourselves. And so the first pathway of the nervous system, or one of the pathways of the nervous system, is a connection/social engagement pathway. And so this is a parasympathetic response. You can think of this as like the rest and digest. And so during non-stressful environments, if we are emotionally healthy humans, our bodies kind of stay in this social engagement state. And if we're happy and normal in a non-freak out mode, basically our nervous system is taking what's called the ventral vagal pathway. And so think of that as kind of like an equivalent to a green light to normal life and pursuing exploration. And so when we're in this social engagement state or the ventral vagal state, we're able to access states that kind of tell us that connection, safety, and orientation to our environment is all good. And so we have greater access to our intuition, our insights. We're calm, we're alert, we're relaxed, we're aware, we have coherent thoughts, and we can experience a whole range of emotions, including joy, presence, groundedness, mindfulness, compassion, curiosity. And so new learning can occur here. And due to the ability for us to self-soothe in this nervous system state, we can regulate our emotions and modulate fears and really build new healthy brain pathways when we're starting to connect with self. And so physiologically as well, our digestion improves, our immunity improves. And so this is kind of the optimal state of arousal. And so you can think of another pathway as the fight or flight pathway. So this is the state of hyper arousal. And so this is basically a sympathetic response to stimulus that is either externally or internally perceived as a threat. And so in fight mode, we are accessing states that kind of indicate movement towards the stimulus. So rage, anger, irritation, frustration. So those are protective states towards the threat. In flight mode, we're accessing states that indicate movement away from the stimulus. And so this is panic, fear, anxiety, worry. And so our cognition here is pretty rigid and chaotic. We can have pretty poor judgment. We have racing or obsessive thoughts. intrusive emotions, images, emotional reactivity, and physiologically our heart rate spikes. We start sweating and we feel like we're ready to either fight or flee. And so at some level, we believe that we can still survive whatever we are perceiving as a threat. And so our ability to relate and connect and learn in these states is minimal because we're so hyper aroused. And so the goal here is to use techniques offered by kind of the other cadres to increase your ability to pivot towards the social engagement state and start to make decisions and actions from a place of clarity in the zone of optimal arousal, which is that social engagement state. And so Stephen Porges found there's a third pathway that our nervous system can take, and that is the pathway of freeze, and that is hypo arousal. And so this is another pathway of the parasympathetic nervous system. And so this actually takes the dorsal vagal nerve pathway, and so it keeps us frozen when we perceive a threat to help us technically survive the threat. And so if your sympathetic nervous system has kicked into overdrive and then we're still feeling like we can't escape the impending feelings of death or threat, the dorsal vagal pathway kicks in and we just shut down. And so it causes freezing and shutdown as a form of self-preservation. And so in this shutdown, we're accessing states that indicate body collapse and immobilization. And so in this state, we're dissociated. There's numbness, depression, helplessness, shame, and then a sense of feeling trapped in that hypoarousal. And so we may have difficulty getting words out here because of that constriction that we feel around our throats. Our brain has decreased metabolism, and so this causes a loss of body awareness, decreased ability to think, decreased ability to kind of lay down any kind of narrative memories. And so at some level, our nervous system believes we are in a life-threatening situation, and it's going to try to keep us alive by keeping our body still. And so what I want to say that our response to any stimulus is basically our perception of the event. And so maybe a traumatic event was very life-threatening and our nervous system responded appropriately to the stimulus. It went to fight or flight. And this is what our nervous system is for. It's for survival. But oftentimes, if we're not in danger or life-threatening situations, we find ourselves in relationship to others, but we're still in those states of hyper or hypo arousal. And so for whatever the reason, or whether the incident was intentional or not, our body shifted into shutdown, and we registered it as either trauma or a threatening event. And so any event that reminds us of a person that's life-threatening can trigger this disconnection and dissociation. And so the question here is, so how do we climb out of shutdown when we're in shutdown, and how can we regulate hyper arousal to get to that optimal state of arousal? And so the entire polyvagal theory should be a thank you to kind of the creation of our nervous system, because even if it is overreactive at some times, our body is watching out for us and trying to keep us alive. And so when you do have the understanding that emotional responses are kind of created and they're adaptive and primal and appropriate, we can get rid of the shame that maybe some reactions have caused. And so my job today is to help you develop an emotional intelligence around your extended periods of shutdown or hypoarousal that come up when you start to communicate with self. And so we can learn to reconnect with the body and the feelings and the emotions. And then this puts us in a state of congruence where your inner feelings and emotions are matching the outer demonstration of those inner feelings or emotions. And so we want to practice a level of assertiveness here. So basically internal leadership. So this can help you feel more in control of your emotional state and feel safe to move into healthy relationship dynamics and really come into a thrive state. And so I want to talk about internal family systems methodology. And so the goal of IFS is to allow your nervous system to integrate these wounded parts of ourselves to be met with new and safe environments in this zone of optimal arousal, so that we can learn to wire our brain in a way that allows for safety and exploration of the 7 core emotions, which are sadness, fear, anger, joy, excitement, sexual excitement, and disgust. And so core emotions are hardwired in the amygdala, and so they are not subject to conscious control. And so, as we talked about earlier, if they're triggered by the environment, each core emotion is pre-wired to set off a host of physiological reactions that kind of prime us for whatever action we need to take. And so if you think about it, it's pretty brilliant. And so we don't want to block them. Their innate programming kind of lets us know what's important and what we do need to kind of work through to thrive. And so our job is to establish a healthy dialogue with the different parts of ourselves so that we can access those core emotional states and thrive in the optimal zone of arousal. And so we're going to talk about now navigating and communicating with self through this internal family systems methodology. And so the way to conceptualize inner dialogue in a productive way is to think about yourself and the different parts of you as a metaphorical family that is nestled within your psyche. And so each level of consciousness has different sub-personalities, and then each one has its own likes and dislikes and burdens and histories. And so each of these parts are thought to play a really distinct role in achieving the self-preservation. So like we talked about, that protection from the nervous system threat. And so every part is responsible for warding off behaviors, actions, or reactions that could result in hyper or hypo arousal. Thus, that means that each part should be validated and recognized as important because it does serve a primary function. But some of these parts, based on the way that we grew up and raised or our environment, could have healthy and productive roles or extreme and unproductive roles. And so I want to kind of break down the 5 basic assumptions of the internal family systems model. And so 1, each mind is different, and so it can have various unknown parts. And so at the root of each part, though, each person has a self. And this self should be the chief agent in coordinating the inner family, all of the different parts within you. And so the self represents the highest seat of consciousness, and each person is, and who each person is at their core. Think about it as your essence. And so the self demonstrates the many positive qualities that you see in that zone of optimal arousal, which is acceptance and confidence and calmness, wisdom, compassion, connectedness, leadership, perspective. And so unlike the different visible parts that you can see, like maybe you think about the inner critic or the self-saboteur, the self is not seen. Think about the self as the witnessing or the I in your inner world. And so this part of you just does observing, and that's it. And so it observes and then it coordinates the different parts of yourself. And so the whole goal of this internal family systems metaphor is to differentiate yourself away from those unconscious and unintegrated parts. And so you want to unburden and really truly restore those extreme and wounded parts and establish a healthy, harmonious kind of internal system that works and is coordinated and led by the self. And so the parts engaging in the non-extreme behaviors are super beneficial to you and also I want to mention that there's no such thing as a bad part, meaning that there's no part that we want to destroy. We have to be able to sit, if you think about it metaphorically, we have to be able to sit at the dinner table with all existing parts, all existing family members per se. And so our role is to help kind of the parts discover their non-extreme roles if they are in an extreme role. And so when you engage in any type of personal development or inner work, this is going to lead you to the development of your internal family system. And so the self, like I said, is just observing and bringing those unconscious parts of you to the conscious family system. And so we want to reorganize the internal system because we're going to kind of adjust the different roles a little bit. And so adjustments made to your internal family system result in changes to your external system. And so we need to make sure that we're matching, our internal changes with external behavioral changes that match our internal environment. And so let's talk about how we can kind of classify these different parts as we start to communicate within. And so the first kind of subgroup of parts is called the managers. So these are the parts that are responsible for maintaining a functioning level of consciousness in your daily life. If positive, they can be very, very helpful, and they can ward off any unwanted or counterproductive interactions, emotions, or experiences from external stimulus. And so if you bring the managers into an extreme role, it can lead to shame, anxiety, guilt, and inhibitory emotions, and that it can block the core emotions. And so when they're in conflict with if you're in conflict with what pleases other people, like your parents, your peers, or your partners, or when your core emotions become so intense that our brain wants to shut them down or to protect us, basically go into hypo arousal, these managers kick in, and that's what kind of leads our nervous system down those different pathways. The second group is firefighters. And so these parts serve as distractions to the mind when what's deemed as exiles break free from suppression. So the exiles are the wounded parts. We'll talk about that. But in order to protect our consciousness, our self, from feeling the pain of the kind of wounded parts of ourselves, these firefighters prompt us to act on impulse and engage in behaviors that are indulgent, addictive, and sometimes abusive, whether it's to others or to self. And so a lot of times these firefighters kind of lead us into those sympathetic states. And so there's a infinite number of defenses, but some of the common ones in our culture is joking, sarcasm, criticizing, spacing out, procrastination, preoccupation, negative thinking, misguided aggression, working too much, over-exercising, overeating, under-eating, excessive sex, obsession, addiction, food, alcohol, drugs, any of that. And so think about these firefighters as the ones that are putting out the fire. They see that these exiles that we're going to talk about, which are basically the parts that are most often in a state of pain or trauma, which have happened from probably childhood experiences or experiences in your environment. These firefighters really, and managers, try to suppress the expression of the exiles because they don't want the self, the leader of all of it, to experience the pain. And so the managers and firefighters prevent them from reaching a conscious level, just so that preservation of self is maintained. But sometimes that inner preservation of self isn't really exactly in a thrive state. It's actually running on these old narratives. And so that's what rearranging our parts is going to consist of. And so the managers and firefighters move into either hyper arousal or hypo arousal because these exiles cause intense fear anxiety, shame, and guilt when brought to consciousness. And so the managers and firefighters play the role of protectors, and the exiles are the parts that are protected. And so what we're going to talk about is, so when an event or situation causes you distress or to be off balance, so what can you do? How can you start these inner dialogues, rearrange these parts? And so the first thing that you can do is truly determine where you're at. So are you in a defensive state? Are you in that hyper arousal state? Is your heart rate flooded? Are you feeling chaotic? Or are you feeling dissociated? Do you feel kind of out of body? Do you feel shut down? Or are you in that optimal zone of arousal, and can you make clear decisions from this place? So after we kind of determine where we're at, we want to determine where we want to go. And so we have to identify the state. So are we in fight, flight, freeze, or optimal arousal? If you're in the fight or flight or the hypo arousal freeze state, you want to pause and breathe and calm yourself for at least 10 to 20 seconds to try to connect with the deep core, the physiological response that's going on. Because if you can feel physiologically where you're at, you can start to think about, am I in hyper or am I hypo? And then once you're there, then we can kind of move and access these core emotions. And so if you're not in a life-threatening situation, then you can create a sense of safety for yourself. And this is called reparenting. And this is where you can use that self as the internal leader. And basically you can create a sense of safety. If you don't feel safe, if some kind of emotion is coming up, it's leading to a sense of not feeling safe, what you want to do is you want to physically surround yourself with someone who is safe to kind of talk through what's going on. Or you can mentally visualize yourself going to a place that feels safe to you. Whether it's, you want to visualize yourself going to the forest, or you actually go to the forest. Or if you visualize yourself in your soft, cozy bed where it feels so safe. If you want to actually visualize like a parent and inner child, whatever makes you feel safe. And so then you're going to attempt to access and name all of the underlying core emotions that are coming up under your physiology. So sadness, fear, anger, joy, excitement, sexual excitement, and disgust. And so if there are more than one, just name any of them that you can. So the goal here is not figuring out why they're there. That is kind of like the managers and the firefighters' MO. It's like if you don't have a why, they're overactive and out of control. And so remember, the self is in control here. And so you don't need a why right now. You just need to access and kind of get into those exiled parts and kind of see what's underneath them. What are those exiles trying to tell you? And so you want to listen without judgment on what the emotion is telling you. So this is where you kind of pull that internal family system in. So what is that part of you trying to say? Can yourself, your capital S self, be a parent in a moment of disruption and then listen to the part that is expressing a need? So even if the manager is out of control or acting like a perfectionist and fear is running the show, listen to that fear. But what's underneath that fear is oftentimes like a sense of anger or guilt or shame. And so we want to listen to like what is underneath all of these different experiences. So then listening to what the core emotion is telling us in the moment, by honoring what it says and then letting the associated physiological responses and sensations kind of move through our body and let them naturally subside. And so whether that's actually like, moving your body through anger, crying with intense sadness, these core emotions are wave-like, and so they want to rise and flow and ebb and move. And so emotion at basically emote means to move through. And so we want these emotions to move through so that we can have access to the narrative from a very genuine place. And so after, and then only after you have kind of grounded yourself, gotten into your body and accessed those emotions, then you can start to use logic and think about the best way that your behavior would reflect honoring what this part of you is saying. And so if it is a wounded exile that, thinks it's not good enough, kind of listen to that and understand what it's saying. And so you want to go through each core emotion. If you said fear, anger, sadness, go through each of them. And so you can ask yourself, is there sadness there? Is there anger there? Is there excitement? Is there joy? Is there fear? Is there disgust? And so another thing too is, at the root of this all is typically a fear or a threat. And so fear tends to feel similar in nature to anxiety, but anxiety doesn't really come with any prescription of what to do. It's pretty paralyzing, and it doesn't inform us of really much. It just kind of leaves us paralyzed in a state of worry. And so fear, we can really move with fear, and we can kind of navigate and have a dialogue with fear and ask fear, what is it, or ask that part of you, like, what is it that you're afraid of? And, if your fear answers you and says, like, I'm afraid of embarrassing myself, or I'm afraid of disappointing others, now you can get somewhere, because fear, just like all the other core emotions, has those hardwired impulses. And so if you understand that, okay, well, I'm just afraid of embarrassing myself, or I'm afraid of disappointing others, like, that puts you in a place where you can make decisions from that zone of optimal arousal versus that state of hypo arousal or hypo arousal. And, it really allows you to pivot towards a life that is in a thrive state. And so basically, in conclusion, if you can become, you can really take on that internal leadership role of self and not be a victim to your nervous system, you can really start to navigate your emotions to become a truly more embodied human. And when you are a more embodied human, you have a sense of control and you have awareness for the options that, you can take in your life, and you have the greater access to, like, the compassionate states, the states of connection, all of those things that as humans we truly are seeking. And so I hope that you guys found this lecture helpful. If you have any questions, you can hit me up. Again, Dr. Danielle McGinnis. Thank you guys.